While we celebrate Black history, it's important to underline that there's still room for vast improvements as it pertains to Black bodies. To be more specific, some Black Alabamians are still fighting for equal access to health care. And during a time when uncertainty has reached an all-time high, a Huntsville area health care administrator paints a picture of the obstacles so far and the challenges that lie ahead. News 19's Dallas Parker has the story.
Tracy Doty joined the Huntsville Hospital team as a night shift ICU nurse fresh out of college. Today, he's worked his way through the ranks. He sits before us Huntsville Hospital Maine's first ever Black president. He came into his role at a time when COVID-19 cases were once again on the rise and the virus ravaged Black and brown communities here in Alabama.
We all know Alabama is one of the at the bottom of the list when it comes to healthcare disparities, and you look at that, there's many ways to define it, but you look at rates of diabetes, high blood pressure, asthma, access to health care, affordability. We know that people in the brown community a lot of times live in multi-generational homes. We know that when it comes to COVID-19, they didn't get furloughed home.
Doty says with many Black Alabamians being coined essential workers, they were at the greatest risk for contracting the virus and getting severely ill. When you think about Black bodies, healthcare, and science, efforts haven't always been on the right side of history.
The Tuskegee experiment, it started in 1932, and we've all heard about it, the Tuskegee experiment, and it didn't end until 40 years later to 1972.
During this period, hundreds of Black men in Tuskegee, Alabama were injected with syphilis and left untreated so that scientists with the U.S. government could study the effects of the disease.
Most Alabamians of color, I know people in my family, they know people or they know people's friends or cousins that were in that experiment.
Fast forward just a few decades.
Then you lay on top of that just the leeriness of the government saying that here's something for you.
A series of COVID-19 shots.
Rightly so, there's some apprehension.
But Doty says with time, knowledge, and community action, that reluctance lessened.
And we met with our pastors, definitely North Huntsville and Triana and other locations to partner with them. We know most times people of color like to go to places where they feel comfortable. And a lot of times those are churches or community centers.
That direct outreach under the direction of Doty has contributed to a vaccination increase in Black people across the state.
African Americans were about 60% with both their doses or their serodose done in our state, which is a pretty good number considering Alabama and the stigma that we have with health care.
However, the fight for representation and equality in health care continues.
We're in a state where racism was once very prevalent.
But Doty says there's an active effort to improve health care accessibility and comfort.
We're definitely trying to make sure we have physicians of all races in especially our primary care network. We're making sure that people feel welcome when they come here.
Black history in the making. In Huntsville, Dallas Parker, News 19.